Normal routine checkup starts at birth. Even at birth, see, a pediatrician has to have a look at the eyes, and if any gross abnormalities, they have to refer to an ophthalmologist. For every age, there will be something that we have to look out for. Even in a very small child, a parent's observation is one of the major checkups. The parents have to observe what kind of activity their child is able to do, is able to watch you, able to follow light, able to follow small toys, colorful toys, if there is any asymmetry in the size of the eyes. So that is something, that's the first checkup actually. You start off with at birth, the pediatrician notice any gross abnormalities, and then no child is born with a 6x6 vision. It happens over the first 6 to 8 weeks, and then the child starts noticing you, child starts responding to you. You notice any abnormality, maybe compared to other child, maybe other children that you have seen. Every time you go to a pediatrician, he will notice, he will do some checkups, he will try to notice for any gross abnormality. Again, I'm talking about gross abnormalities. As an ophthalmologist and eye surgeon, what we recommend is that the first checkup should be done when the child is around 3 years of age, when the child starts to read the chart. Okay, vision chart is important. You don't need a thorough checkup, going to an eye surgeon and putting drops and everything. That's not required. Actually, by law, every school is mandated to do annual screening for vision. And what the school has to do is arrange a screening wherein at least the children who have less than 6/12 of vision should be referred to an eye specialist for a more thorough checkup. These are screening exercises. Again, these are not complete eye checkups. These are screening exercises. At any time it is noticed that the child doesn't have good vision, he goes for a thorough checkup. February, March is the time when I do get a lot of parents. They're having problems, they're getting headaches, and please check his power. And power तो बढ़ गया होगा, अब तो पक्का है. So इतना पढ़ाई करते हैं तो power बढ़ गया होगा. This is the worst time to check the power. See, when we're talking about the spectacle power, not going into too much detail about the working of the eye, there are two aspects to it. One is the error in the eye, the zero error. Okay, you're taking a measuring tape and it's measuring 6 instead of instead of a 7. So if there's a 7 millimeter thing, it will measure 8. So there's a 1 millimeter gap between the actual measurement and this thing. So this is the zero error. But this is what we want to correct with glasses. There's a constant error. The other part is the dynamic thing. The eye is not a one simple structure. Okay, it's at one time you're looking at outside, it's a colorful thing. Suddenly you start seeing something which is just 20-30 centimeters close to you. Even if in a camera, it keeps on changing the focus. The lights keeps on changing. So the eye is a very dynamic structure. When you are constantly focused, you are studying 8 hours at a stretch or 10 hours at a stretch, you are constantly focused at a particular distance. Your eye muscles are tired. Eye muscles are sometimes overactive. It's going to spasm. So it takes that eye to relax. It takes an eye, and if you go and get your power checked up at that time, the power will be wrong. The power is bound to be wrong. Okay, the only way to find out whether the power actually increased or not, wait for the exams to get over, give your eyes adequate rest. Most of the time it will just revert back. Or we check up properly by putting eye drops to relax the eye muscles, get the actual state of the eye, to negate all that, the strain that is pent up inside the eye. So you relax the eye muscles with eye drops and then check the power. Exam times it's not required. Most of the time if we just do a proper checkup, we just find it's the stress of the exams itself. It's nothing more than that. The power hasn't changed, and we don't need to change the glasses. When you're reading a lot, when you're studying a lot, or these days you are using the computers a lot to study. So a computer use or even reading causes dryness in the eye. So you shouldn't be confusing the effect of the dryness in the eye with vision issues.